Okay, everybody, thanks so much for joining us today for our partner webinar series. Jason, can you believe this is our 12th webinar that we've done in a series of 16 partner webinars? We do have some more coming up, and I'll give you more information on that when this is over. But welcome to today's webinar with Jabra, where we're going to talk about trends in education and telehealth environments. Our presenters today will be Paul Ahrens and James Green with Jabra, and Jason Byrne with NetSapiens, and I'm Sue John Siracusa. I'm the Partnership Manager for NetSapiens, and I'll be your moderator. We do want to make this as interactive as possible, so feel free to use this chat function that's on the right side of your screen. We will go ahead and take questions real time. Any questions that you have, I will go ahead and pose them to James, and he can answer them for you. In addition, we'll have a Q&A session at the end. Also, to let everyone know, you will get a copy of the recording and of the slides from this presentation within about 24 hours of the presentation. With that, I'm going to hand this over to James.
Thank you, Sue. Good morning, everybody. My name is James Green, and I am with Jabra. Very excited to be here this morning to share with you what we're seeing with trends in education and telemedicine and how things have really moved very quickly over the last 6 months with the advent of COVID-19. So what I'd like to do is just quickly share just a little bit of a background of who Jabra is and our history. So we've always grown up as a communications company. Most interestingly, we were the first entity to send a line from mainland Europe to China, really allowing for the communication of the Western world to China. And we started over 150 years ago. So today, we are an audio and a video company. We have over 6,000 employees worldwide within 100 countries, with research centers within Denmark, the US, Holland, and China. So when we talk about GN, our parent company, GN stands for Great Nordic, and we actually have really 3 subsidiaries underneath that umbrella. From a medical perspective, we have our ReSound group. For those of you who may be aware, we are best known in that world for Bell-Tone hearing aids. On the Jabra side, we have our enterprise headsets that we've really established ourselves within the contact center and the call center world. And then also we have consumer products. Consumer products, wireless headphones, headsets for working out, headsets for what you'll see in this particular presentation, headsets for a multitude of different people. So kind of jumping from there, let's go right into the education market. And really what I wanted to do is to provide a little bit of a background in terms of just what that market is, from a K through 12 perspective, as well as from a higher ed perspective. So from a K through 12 perspective, within the US there are over 16,000 school districts. The 3 largest states that have the most are Texas, California, and Ohio. From there, we really break it down into there's 130,000 plus schools within the US. Now, those schools include public schools, private schools, as well as charter schools. And then there's over 57 million school children within elementary and secondary schools. And that number is one of the things that we're seeing a real influx and increase in with the need for hearing devices within schools. From a higher ed perspective, there are 4,300 degree granting institutions that consist of over 20 million students, 16.7 million of which are undergraduates. And I have 2 of those undergraduates, and right now that's it's a very interesting time for them. So when we start about looking at where education is going, one of the things that we're looking at is the effect that COVID-19 has had on that student environment. This particular study was done by Brookings, and what it's showing is from a K through 12 perspective, what the impact COVID-19 and school closures has caused to learning. The study that they conducted showed what the retention rate was of students in a typical year through that of this year with the closing. So as you can see from this particular chart, what the solid line represents is really what the average trajectory is in a typical year. So you have the first day of school in September, the learning increases until that last day, and then through the summer months, typically students have a little bit of a tendency to forget or not retain that information. Hence, when we start school again in the fall, there's a lot of review. However, what Brookings found was with the school closings occurring in middle of March, how learning loss has increased over a traditional year. And really what they anticipate, just based on the studies that they have done, is that the starting of this particular fall versus a normal school year, the retention of information in mathematics was going to be about 50%, and the retention of reading was going to be about 30%. So with that, that's really, studies like that have really driven the need to go back to class. And how are schools going to be doing that? So there's a couple of different things that we are seeing at Jabra with a lot of the districts and schools that we are working with. Many of the private and charter schools are continuing, or they have gone back to in-person classes. Typically what they're doing is they are doing active learning while doing social distancing. They are having sanitation stations within the schools, and they're doing everything that they can to follow the CDC guidelines. Typically, those particular entities are going to be a little bit smaller in terms of enrollment, so they have the flexibility and the ability to do that. What we are seeing from the public school perspective is a little bit more of a hybrid model and an alternative scheduling model. And in both of those, what is occurring is we are seeing students go on site for 1 to 3 days a week. It could be a Monday, Wednesday, Friday schedule where they are back at home or doing remote learning on the off days. In some cases where I referenced the Swedish model, what they are doing is the younger children, the pre-K through 5 kids are going on site, but the older kids, the middle schoolers and the high schoolers are staying remote. Some other things that we're seeing, again, back to the alternative scheduling, is we are seeing a lot of school districts that are giving that parent and that student the flexibility to do what they need to do. If it's a better environment for that student to be on campus, to be with peers, a lot of them are having that. And again, some of our biggest school districts are just continuing to remain fully remote. Again, a lot of uncertainty with COVID in terms of transmission, et cetera. A lot of school districts are playing it safe, and I guess we can't blame them in doing so. So one of the interesting things that we found was that kind of going through this back to school is that 75% of public school districts anticipate to be either hybrid or fully remote through at least the first semester. A couple of things, we're seeing that change a little bit. Second largest school district in the country, Los Angeles Unified. There are talks there about maybe starting as early as November, but again, typically what we're seeing is hybrid or fully remote through at least this first particular semester. So with that, what are some of, and being remote and being hybrid, what are some of the challenges that are facing the schools? Well, one thing to realize is prior to COVID-19, only 25% of schools offered any kind of online curriculum or online courses. And if you break it down, it was even smaller in terms of traditional public schools. 20% of public schools offered any kind of online capabilities. It was interesting when you got into the charter schools offered a little bit more options. They offered 30% access. But then if you really looked at some of the smaller schools and private schools, of those, only 3% had any kind of an option. Coupled with that online content was the ability to have computing. A lot of school districts did not or do not have the ability to provide one-to-one computing for their students, meaning a student can go home with a Chromebook, or students can go home with an iPad or something to be able to do their learning. As the slide shares, 41% of schools do not provide computing devices for their students. So when these kids are home, that's a big vacuum of, okay, how am I going to learn? For those that do have resources potentially at home, there's the need to share with siblings, maybe the need to share with parents who are also working from home. Next big challenge that are facing schools is internet access. 14% of children do not have internet access at home. And then next slide, I'll share some of the interesting things that school districts are trying to do to address that. But really, when you look at, when you look at computing and if you look at internet, what we have found is, and what the studies show, is that 4.4 million households with kids, school-aged kids, don't have consistent access to computers or internet for conducting online learning. But you'll see a lot of entities are working quickly to address that. One other thing that's a challenge that's facing schools, and really one of which everyone's learning all the time, and learning is as we progress, was the learning environment itself. Many students, again, if they have siblings or parents working at home, they don't have access to a private or a quiet place to learn. And for those particular schools and districts that were going to a hybrid model, those that were in the hybrid scenario perhaps didn't have the opportunity to hear the kids that were asking questions that were online. And so that was a void. And then finally, what we're seeing is that the educators are hindered. Teachers are spending a lot more time trying to do troubleshooting with technology problems. Again, for those districts that do have their kids bringing home devices, the teachers become an IT professional. And with the technologies that they have, they're really limited to teaching from their desktop rather than teaching from the rest of the resources that they have within their classroom. Could be whiteboards, it could be presentation areas, lab areas, etc. From a higher ed perspective, what are some of the challenges that they're seeing? Well, first off, they're seeing decreased enrollments. Probably part and parcel is because they've started increasing their fees. So you can see 31% of fees have increased for the higher ed since '07. They're seeing an increased competition for students with trade schools and other career type schools, for welding, for automotive, for IT, etc. A lot more of those establishments have come online over the last few years to really compete for those particular students. And students are becoming disenchanted with remote learning. They feel that with remote learning, they have less access to the faculty. They have less access to staff hours. They have less access to just in-person interaction. Adding to that, some of the challenges for student engagement, and this is a study that we conducted, Jabra conducted, and we conducted it amongst our customers in both K through 12 and higher ed. So as you can see from the chart, prior to COVID-19, most classes, or few classes, 30% of classes were done with a virtual lecture. After COVID-19, went up to 61%. Conversely, as you can see, the FaceTime and face-to-face interaction with students was over 70%. Versus after COVID-19, that FaceTime and that interaction was down to 24%. So we saw on an average, the loss of FaceTime per day with students and instructor was 3.5 hours. And again, as I mentioned on the prior slide, 88% of the teachers were encumbered with having to rely upon laptop cameras that they had on their particular devices. And then finally, one interesting stat that we had was that of students and their satisfaction with the qualities of the audio and video, 44% of students were not satisfied with those learning experiences. So, how are schools adapting? From a K through 12 perspective, this chart kind of focuses more on that. So what we are seeing is we're seeing increased access to remote teaching platforms. Microsoft Teams usage is up 70%. We all have read the studies about Zoom imploding with their usage. I believe they went Zoom overall, not just in an education perspective, but Zoom went from 10 million users to 300 million users. Google Classroom doubled its usage from March to April. We're seeing districts becoming very creative. One of the things I referenced was internet capacity. So one of the things that they're doing is they're sending out their buses into the community to act as Wi-Fi hotspots. So to provide their community with internet access for those kids that are staying at home. They are also providing students with hotspots for their home use. They're providing more one-to-one device ratios. As one example, New York City Public, they have a roughly 600,000 students from total within their class sizes or their student population. They provided about half with iPads. Google as another example. Google has donated over 4,000 Chromebooks to some of its customers, and they're actually providing internet access to over 100,000 households within the U.S. And then schools are also adapting to new technologies. So new instruction and class management platforms have been developed that really help teachers develop lesson plans, to provide that data that they would normally provide in an in-class environment online. And they're adopting enterprise-type technologies. So technologies that, for an example, that we provide at Jabra, that you would maybe see in more of a commercial or enterprise environment. How higher ed is adapting? Well, they are improving their online and hybrid options. Now, one thing of note is that they did not have as big of a hill to climb as K through 12, where many universities offer online options for courses. So they had curriculum, they had courseware, and they had the ability to do that. But one other thing that was interesting to note is the instructors and how they feel their quality of instruction is going, where they're seeing that about 21% of instructors feel that their learning is not effective. So they're seeing that there is a benefit for continuing with this online option. Campus creativity, having the ability to have more open spaces and outdoor spaces is allowing campuses to provide outdoor options for classrooms, again, providing for social distancing, providing for outdoor where the virus is less likely to be caught. And they're also ensuring that the students have the necessary tools. Again, consistent course design, ensuring that the kids, it could be a economics class, it could be a history class, different professors or what have you, but the students have different, the students have a consistent means to be able to take one class or the other. So there's not a great learning curve moving from one course to another. And then an increased usage for video with student engagement. What we're seeing again is that increased usage where faculty, again, noting that they want to have more interaction and face-to-face time with their students, they're employing video more. So what's Jabra doing and how to address some of these things that we're seeing, some of these challenges with our products? So one of the things that we're trying to do from a high-level perspective is we're trying to empower the educators in what we're calling the new normal. We want to unencumber or enable that educator to be at their best, to provide them the ability to move about their teaching environment, to engage and to use the familiar tools at their discretion. That we are seeing that the classroom is expanding from a K through 12 perspective. Many of the teachers are working from their garages. Some of them have the ability to work within their classrooms. At the higher ed perspective, many universities are creating studios where professors can come in and conduct a classroom. We want to ensure with our particular products that the educator has, again, access to their normal teaching tools, whiteboards, blackboards, normal video props that they may use and interact with. And then again, we want to ensure that the students remain satisfied and really kind of keep their attention. So how we're doing in that from our particular product, there's a couple of different things that we are providing, and we have seen just an explosion with this particular product over the last 90 days, which is our Panicast product. Our Panicast product is a web camera product, and really, I think web camera kind of does it injustice, but it's a web camera product the size of your smartphone. But what it allows is it captures a 180-degree field of view within that environment. It allows that teacher to work from a presentation area to a classroom area to a desk area, and the student can see him or her as he's conducting his lesson. From a hybrid or from a remote perspective, it's about the closest that an instructor can get to conducting an in-class experience. One of the things that our particular product does with Panicast is we have a software application that captures whiteboard. This allows the teacher to interact with their whiteboard, and the students can still see it. If you would, an example I'll use in a Teams or a Zoom call, one of the boxes that would be employed would be an up-close view of the teacher's whiteboard and how they are interacting with it, the notes that they are writing on it, the formulas, if it's a math problem, etc. And the neatest thing about that is that because our product provides that field of view and 3 cameras that does that, is that that whiteboard can be anywhere within the room and it can be captured. The other thing that we're doing is when we're looking again at the remote classroom perspective, one of the challenges that I referenced was the ability to be heard and to hear within the classroom. To be heard, those students that are at home, remote, or perhaps on a hybrid day when it's not their day of the week to come in, and for those students that are in the classroom. An example of how we're addressing that is with our Speak Series product, our Speak 750. This particular product allows that educator to have what we would consider a normal conversation. The technology, we call it as a duplex conversation, but it allows for a traditional back and forth conversation. Now, why that's important, again, is you have students that may be in the classroom that can now hear the question that their student at home, or that their colleague or classmate at home is asking online. And the other thing that we're doing, and this is one thing that's very interesting, is we have migrated very quickly to providing students or headsets for students. One of the things that we're seeing again is when these kids went home and students went home with devices, they went home in a more noisy environment. They went home in an environment where they're sharing space with siblings and relying upon a Chromebook or another device's microphone and speakers to be able to be educated that day. Well, in a lot of cases, that's not sufficient. Student could not hear the instructor couldn't hear the student. One other thing that we are finding as I guess an added benefit to the headset is when the student is wearing the headset, It shows the instructor that the student is engaged in class. If the student has his headset on and the earmuffs are on both of those ears, it is something that the instructor can say, hey, I can understand, I can see that James is here to learn. So with our products, one of the things, again, from a product that was designed for call centers or for all-day usage, those same elements that we have with these particular products fit in for a school day. So the product's durability, our products fit in comfort. One of the most interesting things is our product safety. We have technology that's called Peak Stop that really it stops loud, excessive short noises that could do damage to a student's hearing. So that's a little bit of what we're seeing from an education perspective. I'm going to let me turn it over to Jason, who will begin our discussion with telehealth.
What I want to touch on is what does NetSapiens bring at the platform level? James done a great job on the endpoints. What NetSapiens brings is the platform, the full unified communications, the video conferencing, the collaboration, the contact center. What we are a platform provider to about 170 plus service providers, got a 1.4 million users on our platform. Puts us in the rarefied stratosphere when it comes to platform providers. And then of those three big solutions, the use cases in there, whether it's messaging, running virtual classes, cloud calling, for switchboard, multi-level IVR, all the functionality that's inside unified communications, it maps directly to education. And that's what I'm trying to convey is unified communications is a perfect match. Just have to Google what's going on and just put in unified communications and education. There is just tons of content out there and different use cases that I probably even haven't touched on. But what I want to highlight here is, so now you've got a platform and the Jabra combined. So you've got the platform and the endpoints. How do you make yourself sticky? And I think, obviously James has touched on some of the great products they have to help bring some additional synergy in there. But also, if you look at, let me see, sorry. If we scroll to the next slide, you can see here through APIs. I mean, stickiness typically does not come from standard platform features. As much as we like to give you as many dials and knobs to turn to make it a very customized solution, APIs is where we bring in that stickiness, right? Integrating with the learning management systems that are used today in education, like Canvas is a big one. Moodle, we're looking at Moodle specifically, but through the APIs, you can cherry pick what features you want to bring, which of these LMS systems you want to integrate and tightly integrate yourself, and then bring that value to your end customer. So I think this is one of the key things I want to highlight. You've got all the infrastructure and the plumbing underneath to support all the features of that education demands. Now, if you can make yourself sticky by bringing in some of that tight integration with the Canvas or whoever on the LMS side, that's a big part. I think big play on the education side. So now I think the second part of this conversation was around telehealth and telemedicine. What I'll do is I'll hand back to James here in a few minutes, but I just want to touch on the high level, what is telehealth and the market itself and the drivers. Telehealth, really, it's different than telemedicine. It's more of a broader scope. Telemedicine refers mostly to remote clinical services, and telehealth includes that plus non-clinical services. It's the best way I can describe it. Types of telehealth basically falls into 4 different categories. You'll see provider to patient, non-hospital, all the way down to physician to patient. Just look at the pie slice on the right-hand side. That tells you what the telehealth use case that dominates, and it's provider to patient, and non-hospital, remote, and number 1 use case in telehealth. How big is this opportunity? Just look at the bottom here. McKinsey has it at $250 billion in healthcare spending, shifting to virtual care models in the wake of the COVID-19. So recent data. That's significant, right? That's a big market, no matter which way you look at it. Now I want to give you a snapshot of what is it exactly. Tell me what this telehealth is. I've got a great slide here, and this is recent, so July 2020, during COVID. If you actually look in here, it starts off with the top procedure codes, which is language, I guess, healthcare uses. During COVID, the US government added in an additional 80 procedure codes, so additional 80 services is the best way I could describe it, that telehealth can be used for. And if you look on those two tables in the top left, and also what's the most used, if you look at the big bar charts down the bottom, you'll see July 2020, obviously mental health conditions, but then they're starting to grow in the other ones and the different use cases. What are people calling in for? How big is this? Just look at the top right-hand side. So now we've explained what it's being used for. How much is it being used? And you can see last year, telehealth was less than 0.25% of all claims. That's now gone up to 8% in the space of a year. That's almost 4,000% growth in telehealth in 1 year. Mind blowing. And they don't expect that to slow down. I mean, it's crazy. And if you actually break it down by, the claims by urban versus rural, you can see the urban is roughly around that 4,000% mark. But if you do rural, you can see 0.06% growing to 6%. That is roughly 10,000% growth in 1 year. Significant opportunities. So I wanted to frame the problem or frame the opportunity, and I thought this slide was a good way of framing the opportunity and what the typical use cases, conditions that folks call in for, so you get a breath of that or an idea of that. If you look at the next slide, now let's tie it back, right? So now I've got up to the 40,000-foot view. What are the typical use cases in telehealth? And this is independent of UC, but I'm going to map this to UC. So if you look at, the first thing you can, where UC can help really is a dedicated response teams. These are things where like dynamic call routing capabilities allow dedicated teams to manage all facets of telehealth service calls. In healthcare, you can imagine call volumes vary quite a bit from day to day, time of day, that sort of thing. So really a solution needs a dynamic overflow of calls across different sites, different departments, that sort of thing. So a multi-level IVR might help there. Patient follow-ups, you can imagine video conferencing, or not conferencing, but video calling, one-on-one video calling. Voicemail transcriptions are being used by doctors today, where they'll actually rather read and then respond. It's one of the most common use cases in patient follow-ups. And then self-service, right? So again, multi-level IVR, getting to the department, getting to online fax, or not online fax, but more details, more information coming across through IVR. Mobile health, clearly having a mobile app, for that one-on-one chat, messaging, phone calling, that sort of thing. Another use case, doctors on the ward that can't be reached, whatever, or they're not even in the hospital these days, whatever that is. Having a mobile app is certainly part of that picture. And then system monitoring, right? So everything, all of the above that I just described, having a full admin portal to provide visibility across the whole UC, across the whole video conferencing, across the whole contact center, having that system monitoring and the ability or the visibility that you need in order to run that system. And then obviously remote workforce, whether it's nurses or whatever, doing some diagnosis over video. These are the most common, and I've seen lists of 10 use cases. I just stopped at 7 here. You can see some recent numbers, and again, COVID numbers, 1 billion projected interactions in 2020 over telehealth. That's significant. I did see a stat here, the FCC is funding COVID as well for telehealth, and put 200 million in. So I just thought this is pretty interesting data and more around the use cases. Now let's map it up, and this is my last slide before I pass it back to James. So currently telehealth is served. It is served by platforms, and some of those platforms, are not, let's call it Telehealth 1.0. If you actually search Telehealth 2.0, you'll see a lot more cloud communications and cloud UC, all part of that picture, versus the 1.0 flavor of telehealth. lacks really in these channels. So I actually came across a really good webinar where there was a survey taken across the industry in telehealth, and the critical features missing on the platform. Start off with the number one is collaboration. Ooh, guess what? This is where you guys, where a NetSapiens platform can bring a lot of value. Multi-channel communications, whether it's a desktop, mobile app, desk phone, whatever that is, multi-channel, and all under one platform. That's the number two. These are things that are missing on today's telehealth platforms, and you can see it's a perfect match for unified communications. Centralized administration, we talked about having that, admin portal to manage all aspects of the communications. Diverse endpoint support, and this is where I think, Jabra comes in as having that. They have a very diverse product line for various different use cases. Having that support all embedded or tightly integrated with a platform like ourselves, these are the key things that are missing from today's platform. And I touched on APIs and integrating and carving out your niche on education. You can see here, it's the same thing. I mean, you just look at the difference. There's various different tools or solutions that are out there and companies with their own software. In the UC space, this is like integrating with CRMs. In telehealth, they have their own systems. And through those 240 plus APIs that NetSapiens provides, you can certainly carve out a niche that no one else can bring to the table. And that's something I wanted to touch on as well. So at the platform level, just to sum up, I think having a tightly integrated solution with the likes of Jabra on the endpoint side, having all the collaboration tools, the contact center, and all the video conferencing, you've got all the ammunition you need to go chase this space. And then through some additional API work, cherry picking some of the applications and use cases to make yourself very, very unique and sticky inside. I think that's some of the key takeaways here that I want to touch on. With that, I will pass back to James, who will get into more detail around what Jabra brings to the table in telehealth. So
thank you, Jason. So thank you, Jason. And one thing I want to thank you as well for helping reinforce my presentation. The value of you had a problem with your laptop audio. So Paul Ahrens, who's on the phone, we will send Jason forthwith a Speak 750. So I thank you so much for helping reinforce my message.
So I won't name the vendors that I do use, but yes, any products greatly appreciated as evident today.
So let me go back into screen sharing. Okay, looks like we're there. So, okay. So excellent information from Jason with telehealth, telemedicine. And again, that's something that has really imploded with the onset of COVID. A couple of things that we're seeing from a trends perspective is first off is yes, how do you classify telemedicine? I mean, really, it's anything that you would see within a physician's office: physical examinations, it could be psychiatric examinations, optical, etc. Prescription writing, what have you. Other areas that we're starting to see it. Another great example is teletherapy, physical therapy, where not only the patient is on video, but more importantly, the provider is on video as well. And with our particular product, again, with our Panicast product and that ability to show a wider field of view, the provider can show an entire body rather than just being limited again to that webcam on their laptop. As Jason mentioned, a lot of patient to provider and provider to patient applications. But one of the things that we're also starting to see a lot of is provider to provider elements. It's not growing as quickly, obviously, as provider to patient, but it's that provider to provider. Imagine a rural area that needs to have a consultation with with a radiology department that they may not have, and so they have the ability now to be able to do that. COVID-19 obviously put a big stress on the system, but I think it also opened up opportunity. With that, telemedicine allows that provider to continue with their patient care at the remote setting. And one other interesting thing that was allowing to do, when early in the pandemic, strained for resources and what have you, it allowed retired physicians to re-enter the market. Re-enter the market, maybe not necessarily to treat COVID, but to treat not COVID or non-COVID, and to do it in a safe atmosphere. One of the biggest trends that's occurring right now is licensing and regulation barriers. The good thing is, again, with the advent of the disease, is many of these barriers are being removed. So the ability to license and treat across state lines, states are improving. More states are becoming friendly for cross-state line doctors. And equally important for not only the provider, but as well as the patient, is insurance reimbursement. The barriers for insurance reimbursement are also improving. And the one last thing, Jason referenced growth. Yeah, it's growing amazingly. I mean, and this figure may be off a little bit, again, with the growth of with COVID, but they're expecting an annual growth rate of 18%. And a value of $17 billion by 26. And we could see that growing even more. One interesting thing from a Medicare perspective in terms of growth, in late April, they were conducting 1.7 million telehealth video visits per week in late April after the pandemic. That was up from 14,000 a week in March. So you can see how it's just exploding. A couple of more trends that we're seeing is that telehealth.
Hey, James, I'm sorry. It looks like your slides just dropped off.
Oh,
could you unshare and share again? Yeah.
Yes. Thank you. Thank you for making me aware. No worries. Hopefully we can. Okay. Continuing with trends. So the improvement of patient care. So it allows for specialists to treat those that are in rural areas. The other interesting thing, it actually allows for increased physician access in urban areas, in areas of our cities that perhaps don't have the quality of care or the number of physicians that may practice in that particular area. And equally important, it provides prompt patient treatment. One thing that we're also seeing, and I'll address it near the end, is mobile health and collaborative care. The use of devices and smart devices and wearables the clinicians are employing to improve that instantaneous communication amongst themselves, the collaboration with themselves and other docs, and really to improve clinical productivity. And then finally, one other trend is the improvement in provider benefits. It allows that provider to be more flexible. It allows that provider to care for more patients. And really, in a health crisis that we're in now, that's very, very important. So what are some of the challenges that is going to face and is facing telemedicine? So one of which is the digital divide. Again, similar to education, it's that access to technology and the internet. Stats show that only 69% of rural areas have adequate internet. So that infrastructure has to be built up. A lot of the applications that we're seeing are based on smartphone apps, in addition to web-based. And again, if we're looking at our rural populations, only about 71% of rural populations have a smart device that they use. When we're talking about HIPAA, when we're talking about other compliances, obviously security is a big challenge. With more engagements, with more visits, et cetera, that just increases that bandwidth. And of course, as with anything, data breaches can be a concern. The other challenge is we have to improve the licensing and we have to reduce the barriers. So today there are roughly 10 states that have a pretty open platform of cross-state line treating and providing care. So that has to be improved. It's rapidly growing, and again, with the advent of the pandemic, I think it's only going to increase. And then a couple of other challenges: hardware limitations for clinicians. So one of the things that we're seeing is on a nursing floor, as an example, the clinicians have to share devices. It could be, we're moving from that physical written chart to more of a digital chart, even smaller devices, but those devices have to be shared amongst workers. One of the things that I'll reference later is one of the things that we're doing to address that. And then really, again, the limitation, as I mentioned earlier, of most cameras. Most cameras don't have that wide field of view that can show not only the entire body, as an example, but also at high definition. And then I think you're always going to have what I like to call white coat phobia and patient adoption. And that's either going to be, that's going to run across the healthcare industry, whether it's going into a doctor's office or doing a call online. People just have a fear of that particular white coat. So again, what are we doing? Again, if you asking yourselves, and Jason did a great segue in terms of what our traditional products would be in terms of our headsets, in call center applications and what have you. But I'm gonna reference a couple that are a little bit outside of that. And with these, really what we're trying to do is we're trying to enable clinicians to improve their quality of care. So we want to remove the challenges from their daily practice. And those challenges could be, hey, how does this web camera work? Or, hey, when I access Bluetooth on my headset, is it easy? Seamless integration with different UCs and different applications. And improve that patient safety. One of the things that I like to stress with Jabra is not only, even though we grew up as a headset company, but headsets, two elements. One element is the ability to hear. The other element is the ability to be heard. So, again, from our perspective, what we're seeing is we're trying to future-proof telehealth with some of our particular solutions. Enable patients to interact with their particular docs how they haven't done in the past. Improve triage capabilities. Improve personalized requests from that virtual exam room. Taking that virtual exam room to be your living room. So, and how we're doing that again is I touched on our Panicast product earlier, but I'm going to kind of get into a few more of the specific benefits that the particular product has. I've referenced multiple times the field of view, but the other is our 4K and our high definition quality. We have intelligent zoom and high definition that allows in certain cases to provide a correct diagnosis. Instant collaboration. This particular product, again, as I said, it can plug into any of the UC applications that are out there, again, making it easier for that provider to implement. And one other element that I wanted to touch on, kind of more specific, is a technology with our Blue Parrot product. It's interesting, but again, this example is going to show how we are migrating. Our Blue Parrot product grew up in the trucking and transportation industry, where truckers would use these devices driving down the road because of their noise canceling capabilities. Well, where we are finding application with this particular product, as an example, is that use again of mobile devices. The use of these mobile devices to provide text messages, to do medication administration, whatever the case may be. They're basically electronic charts, but they have a voice element to it. And with that voice element, what these providers are looking for, and these are providers such as Zebra Voice, Epic, McKesson, Vote, etc., is that ability to instantaneously communicate with others. That could be on a nursing floor if there's an emergency. On this picture, you can see that there's a little blue parrot. That little blue parrot provides for a push to talk. So I can reach out to and speak to multiple people that might be on a floor if there is a code emergency of some sorts. Now, also, as I referenced earlier, what this also allows the clinician or the provider is a personal device. As I said, a lot of these digital platforms or digital products that they use are shareable devices. They could be shareable devices on the floor. As an example, a nurse may grab one device and work a half of a shift and put that particular device away, and then come back for the second half of the shift and grab a different one. But she can always keep, or he can always keep, his headset as a personal device, so he doesn't have to worry about transmission of from one user to a next. So again, just a unique thing that we're doing at Jabra, looking at an existing product designed for an entirely different industry, and how we're employing it within telemedicine. So with that, I'm going to introduce somebody who's on the call. I don't think he can hear us, but I don't think he has a chance to speak. So probably a good opportunity for me to say a bunch of great things about him. Is Paul Ahrens. Paul is our Alliance's representative for NetSapiens. So he is a part of our team that has that's a great resource for NetSapiens and for you for all things Jabra. But one thing that I wanted to bring up is public sector. One of the things, and some of our pricing. So at Jabra, we consider healthcare to be public sector. Again, based on teaching hospitals, community hospitals, county hospitals, whatever the case may be. Rather than separating them out, we include them within public sector. So what that means for you is that we provide upfront 10% discount for public sector opportunities. In addition, when dealing with applications or dealing with particular deals or what have you, we have deal registration discounts available as well. And then our Jabra One partner promise. It's a program that's really kind of designed to help you sell our product, but in doing so, do it profitably and with sustainable growth. We have some reward programs tied into it, and additional tools that can help you become more acclimated with our particular product. One last thing I want to bring up is our public sector team. So our public sector team, again, what we would consider traditional public sector as well as healthcare, but we have a team of individuals throughout the country that can be resources to help you within these engagements. We can help with discussions with your customers. We can help with demonstrations of products. And so these next two slides, you can see who they are. We have two federal gentlemen. So if you are dealing with federal issues, VA or whatever the case may be, Bob and Brian are great resources. We have a resource in Vincent up in Canada. And then from our regional perspective, these 6 individuals cover their respective territories throughout the country. And again, please take this, contact them directly. My information was on the prior slide. You can contact me directly. We can contact Paul. We want to be able to be a resource for NetSapiens for you in any type of engagements that you may have. So with that, I thank you, and we'll be happy to take any questions that you may have.
Yeah, folks, feel free to ask any questions. In the meantime, just to remind everyone, you will get a copy of the recording and a copy of the slides, and that way you'll have all that contact information that was in those last 2 slides that James showed us. And just as we're waiting for questions to come in, just want to give everyone a heads up. Our next webinar will be on the 27th of October with TransNexus. And again, after that, we're going to have webinars coming up with VTech, another one with Poly, another one with RevIO, and one with Yealink. And that's all by the end of the year. You'll be getting email correspondence on that. But again, any questions? Okay, it doesn't look like we've got any questions coming in at this time. But again, so Tim is asking, can you see that, James?
Yeah.
Yes. Yeah, Tim, thanks for that. So I'll be honest with you, I don't believe that was from, I am using the Panicast, but I noticed that as well. I don't believe that's being driven from the Panicast. It could be being driven from the application. But one of the things what that's showing is that the Panicast does have, it tracks facial recognition. So it could have been the Panicast that was tying that information into the feed. I'll go back and look at it. But yeah, normally I don't see that in application. But yes, if it's there, I'll figure out a way to turn it off to answer your question specific.
I guess we covered a lot of it, a lot of great data in there, I think. So I'm glad, Sue, you're going to get the video and the slides out the next couple of days. I think people will be able to digest it because we hit them with a lot of great stuff. So, okay, you wanna wrap up, Sue, or?
Yeah. So again, thanks everyone for joining us. Really appreciate it. You'll be getting a copy here in the next day or so with the recording. Maybe we can even have Jason re-record his portion because Jason, you were talking with such passion on your portion. Yeah. And again, please join us for our next webinar on the 27th with TransNexus, and you'll be getting plenty of emails, correspondence regarding our upcoming webinars. And with that, I'd like to say thank you. Thank you to James. Paul, sorry that you couldn't join us, and we'll see you all again in a couple weeks. Thank you, Jason.
Thank you.
As well. Thank you. Everyone have a great day.
You too.
Bye.